Hello, we are the Association for Child and Adolescent Mental Health, or ACAM for short.
Hi, my name's Lizzy Winstone. I'm a Senior Research Associate at the University of Bristol, and part of my PhD research, which was funded by NIHR School for Public Health Research, was recently published in JCPP Advances, titled Adolescent Social Media User Types and Their Mental Health and Wellbeing. So in this short video abstract, I'm going to give you an overview of the background, methods, results and interpretation. Social media use is thought to be a novel driver of adolescent mental health. In the UK, almost 90% of teenagers have a social media profile by the age of 13, which is the age group that we've been studying. Whereas much of the previous focus of research and policy has focused on screen time, this research examines whether there are mental health implications of how young people use social media. So social media use includes lots of different activities, which we've grouped together as passive, so that's browsing content, direct communication, so messaging, or broadcasting, posting photos and other content. So we used a two-wave panel survey across 19 different secondary schools, and the class enumeration part of the model, which I'll talk about in a minute, included the full available sample at each time point. So in the first time point in October 2019, there was data available for 2,456 young people, and a year later 1,820. And of these participants, between 1,311 to 1,321 had complete mental health data at baseline, in addition to complete demographic and screen time covariate data. So this survey included 13 different social media activities, past year self-harm, we included the hospital anxiety and depression scale, and the Warwick and Edinburgh mental wellbeing scale. So we looked at the conditional probabilities of a certain response to frequency of 13 different social media activities, as I said. So we then used M+ to compare 2, 3, 4 and 5 class model solutions, both in terms of model fit statistics and also interpretability. So that class enumeration part is represented at the top of this model diagram and the latent class analysis. And we then went on to test associations with mental health outcomes a year later, so self-harm, depression, anxiety and poor well-being. And then in fully adjusted models, we included demographic and screen time covariates, as well as baseline mental health. So in latent class analysis, individuals are assigned a most likely class membership, which gives us an estimate of prevalence of each user type. So among 13-year-olds, we identified 4 main user types. The largest group we labelled high communicators. These were characterised by frequent direct communication and frequent passive use, but moderate broadcasting to close friends or peers. Around a third of young people were categorised as moderate communicators, who engaged in moderate communication and passive use with minimal broadcasting. And then 13% were labelled broadcasters, and they engaged in very frequent activities across the board. And then a smaller group were labelled minimal users, who didn't really use social media at all or engaged very minimally in communication or passive use. So as I said, we then tested associations between user type and mental health a year later when participants were age 14. And what's nice about the bias-adjusted 3-step approach that we used in M+ is the ability to adjust and account for uncertainty in class assignment. So we found differences between user types in the risk of self-harm, anxiety, depression and poor well-being. So broadly speaking, broadcasters tended to have the poorest mental health outcomes, and moderate communicators, sometimes high communicators, generally had the best outcomes a year later. What was interesting as well is that minimal users had the same or worse outcomes as moderate communicators, which suggests that some social media use with minimal broadcasting may represent the optimum level of social media use at this age. So we situate our findings as new person-centred evidence in support of the digital Goldilocks hypothesis. So whereas previous research has identified optimal social media use in terms of an amount of time spent online, we reconceptualise that optimal use as moderate use, but primarily for direct messaging and passive browsing of content. And then we further reconceptualise maladaptive use as excessive messaging, excessive browsing of content, but also broadcasting of content or sharing content more publicly. And we might think of this in terms of an accumulation of risks and benefits. So for example, whereas this minimal user group are not exposed to any of the risks associated with any social media use, they also don't enjoy any of the benefits of social media use, such as being connected with peers, information seeking, entertainment, and so on. And some of those benefits are likely experienced by the moderate communicators group without some of the risks or stresses attached to excessive levels of those activities. And then in the broadcasters group at the bottom there, yes, they may be accumulating the benefits of social media use, but they're also accumulating risks or stresses in terms of excessive levels of messaging, which may feel smothering or overwhelming to the sender and receiver. They may be experiencing risks attached to excessive levels of passive browsing, such as feeling guilty about the amount of time they spend online if it's not felt to be constructive, for example. And then they're also potentially exposed to risks attached to sharing content, such as threats to their sense of self and sense of self-worth if an expression of their identity is being rejected by others. So in conclusion, our findings emphasise that social media use should not be viewed as this homogenous activity, either in research or policy. So we find that the majority of young people do not appear to be using social media in a way that's harmful to their mental health. However, we identify a group of users, so that's the broadcasters group, who may be particularly vulnerable to negative online experiences and perhaps warrant further focus in research or interventions. Thanks very much for listening.
Find out more about becoming an ACAM member and to be part of the advancement of child and adolescent mental health. Visit www.acamh.org.